thank you everyone that is here this afternoon. My name is Jessie Moore. I am the physician liaison here with Garnet Health, and I am very excited to bring to you Dr. Aborbi, who is a Garnet Health doctor urologist. We also have Dr. Jerry Galarno, who is also with Garnet Health Doctors in Urology, but I don't believe he is joining us today. But both of them are available and able to provide this fantastic new procedure called Aquablation. I also want to mention that we do have Jeff Keys joining us today, who is our rep who works with Aquablation, so he can assist with any questions or input at the end as well. So I'll go right ahead and give the floor over to you, Dr. Aborbi.
Thank you very much, Jessie, for the introduction, and thank you, Jeff, for hopping on. Didn't realize he'd be here, but that's a pleasant surprise. So I have about a 20-minute presentation here on the Aquablation. I'd be happy to take questions at the end if anybody has any questions. And once again, my name is Dr. Sam Aborbi. I'm a urologist here at Garnet Health. Welcome everyone to the Lunch and Learn session on Aquablation. And we actually have a website dedicated to our Aquablation services at Garnet. And if you'd like to visit it, it's https://www.garnethealth.org/aquablation. So this is really supposed to be a patient-centered talk. So I'm going to try to use lay terms and simplify things. So let's just jump into it. So what are the goals of this presentation? First of all, we want to define what is BPH, or benign prostatic hyperplasia. And if you are diagnosed with BPH, what are your treatment options? And when would someone want to consider aquablation therapy as a treatment option for their BPH? I just want to make sure that everybody can fully see the diagram that's on the right here and my arrow. Can everybody see that? And it's not obscured in any way?
Yes, we can see it.
Okay. So let's start with some basics. What is a prostate? Well, the prostate is actually an organ that surrounds the urine tube or urethra. It sits basically right after the bladder here. And its main role is to provide nourishment for the sperm. So its main role is basically for reproduction, and it's critical for the reproductive years. And once a man is done reproducing, there really is not actually much of a role for the prostate. However, as a man ages, his prostate will continue to grow, and that can become an issue. And in fact, 1 in 2 men who are in their 50s will experience symptoms of an enlarged prostate, and that rate will actually only increase with age. And what happens actually is, as the prostate grows, as you can see here, it crowds the urine channel and hinders the ability of the bladder to empty urine, and gives you the symptoms that we're so familiar with. So basically, BPH, benign prostatic hyperplasia, is prostate enlargement. It's the same thing. And the cause is unknown, but what we do know, certainly I see this every day, is that there is a strong hereditary component. So if your brother has an enlarged prostate, your father has an enlarged prostate, you have a good chance of having a prostate enlargement yourself. And one thing I want to point out here at the beginning is that BPH is not prostate cancer. That's a totally separate entity. Prostate cancer typically does not give you any of these symptoms we're describing. And this treatment that we're going to talk about, aquablation, at least for the moment, is not designed to treat prostate cancer. It's designed to treat enlarged prostates. So what are some of the symptoms that we typically see in BPH? Well, they fall into 2 buckets. The first group of symptoms are what we call storage symptoms, and that's when the bladder loses the ability to store or hold urine as well as it has in the past. And typically with that, we see an urgency or an inability to delay urination. We see patients complaining that they have to urinate every 30 minutes to 1 hour, otherwise known as frequency. Nocturia, which is the most common thing that we see in urology in the office, is nighttime urination, which can be very severe. And sometimes this can progress to actually the loss of urine control or incontinence. And then on the other side of the coin, we have voiding symptoms or difficulty emptying the bladder. And that can present as straining or needing to push to empty, burning with urination, difficulty initiating the stream or hesitancy, a weak stream or a dribble. Intermittency is when your stream starts and stops. And in severe cases, we see a complete inability to actually go to the restroom at all. And in that case, you might need a catheter. And as one might expect, these symptoms can be very devastating for patients, depending on their severity. If you're having to wake up every 30 minutes or 1 hour, as some patients do at night, that's going to have tremendous impacts on your sleep quality. If you're having to run to the restroom every 30 minutes, you're going to plan your day around where the closest restroom is. So that'll limit what you can do. And in some cases, there can be impacts on sexual functioning. So how do we diagnose BPH? Well, in the same way that we diagnose any condition, we typically take a history or ask the patient some questions. We might administer a questionnaire. We'll usually conduct a physical exam and do a rectal exam and check the size of the prostate. And then we might order some additional tests such as ultrasounds, CT scans, or MRIs to also gauge how large the prostate appears. So in terms of treatment is unique to every patient, and that's because every patient has a varying degree of symptoms. And for many patients with BPH, they can get by with what we call watchful waiting, which we'll get into more details in the future, which is basically not necessarily doing anything if the symptoms are not bothersome enough. If they become more bothersome, then medication becomes an option. Or if they're very bothersome, then we have surgical options. And I want to point out here that it's not a necessary path that one has to follow from watchful waiting to medication to surgery. There are instances where we might recommend on the first visit a medication for a patient, and sometimes we'll have patients actually go straight to surgery if their symptoms are severe or they're experiencing severe consequences from their enlarged prostate. So let's talk more about watchful waiting. As I mentioned, this is for patients that have mild symptoms, and it's basically a wait and see approach. And we may offer some conservative guidance for patients. That means making some lifestyle changes. For example, drinking less alcohol or coffee during the day usually helps with frequency. Having patients stop drinking all fluids by 6 or 7 p.m. will usually help with waking up at night to urinate. And we have something called timed voiding, where we have patients use the restroom every hour, even if they don't feel like they have to go, to always maintain their bladder in a relatively empty state. And we might even recommend weight loss, different things. These fall in the basket of watchful waiting. However, for most men, their prostates will continue to grow with time, and so watchful waiting may work for a time and then become less effective. And that brings us to the next treatment, which is medication. So with medication, this is for patients typically that have more mild to moderate symptoms. And the medications that we use, you may have heard of, include Flomax, Uroxetrol, Proscar, finasteride, which is Proscar, Avodart. There's really a whole slew of medications that work in different ways. Some of them will actually shrink the prostate. Some of them will relax the muscle around the prostate. Some of them will actually relax the bladder muscle. And sometimes we'll prescribe more than one at a time. However, like any medication, side effects can occur and may impact a patient's quality of life. And typical side effects that we do see include inability to ejaculate with certain medications, loss of libido, low blood pressure. And so some patients are not willing to take these medications, or these medications may become less effective with time. And that's when we move to surgical options. And that's for patients that have moderate to severe symptoms or who cannot tolerate medications. And so the two types of surgical options are what we call non-resective procedures or resective procedures. In non-resective procedures, no tissue is actually removed, so there's no cutting involved. This is more of a minor procedure where patients typically go home the same day. An example of one of these procedures is something called an iTind. That is a procedure that I also perform. That entails going in with a patient under sedation with a camera and deploying a small stent or wire cage within the prostate, within the urethra of the prostate, that will actually expand the channel over time. And that stent is left in for 5 days and is actually removed in the office. And so that by doing that, it actually is helping to keep the prostate open for a long term. But it's only available for men that have smaller prostates. So many patients are not candidates for that procedure. And in addition, we don't know how long that procedure, the benefit of that procedure actually will last. So for larger prostates, we actually have to move to resective procedures where tissue is actually removed. These are, as you can imagine, more invasive procedures, still done through the urethra for the most part, so meaning done endoscopically with cameras and without cutting for the most part. But they do almost always require a stay in the hospital overnight. So I have listed here 3 possibilities of resective procedures: the TURP, which patients will fondly refer to as the prostate roto-rooter, which is basically using an electric cutting loop to remove tissue from the prostate and cauterize it. We have laser treatments like green light laser, holmium laser of the prostate. And for very large prostates, we have something called a simple prostatectomy, which is actually a bit of a misnomer because it's not simple. It involves making an incision in the abdomen, an incision in the bladder, and in the prostate. It's quite effective, but as you can imagine, with all those incisions, the healing can be longer and there are more risks in terms of bleeding, and so on. So what aquablation is, and aquablation, what that has done is basically bridge the gap between having the side effect profile of the non-resective procedures and the major benefit of the resective procedures. So it's a new advanced procedure that combines long-term relief with low rates of permanent complications for all prostate sizes. So what exactly is aquablation? As I mentioned, it is a resective procedure that uses a high-power water jet to treat the prostate. It is the only procedure to use a heat-free water jet that is controlled by robotic technology, is precise and consistent, and can be performed on prostates on almost any size with low rates of permanent complications. In fact, in many studies that have been published, the rate of permanent erectile dysfunction, orgasmic dysfunction is actually 0%. And 9 in 10 men actually will preserve their ability to have produce ejaculate when they have an orgasm, compared to very few men that actually will undergo a TURP or simple prostatectomy. And also, very importantly, almost every patient that has an aquablation will be able to control their urine and not have urinary leakage after the procedure. So here's an overview of how the procedure works. First of all, you have to understand that every patient is unique, every patient's prostate is unique, and the anatomy is different. So we have to create a surgical roadmap, and we do that in 2 ways. The first step is we place a camera inside the urethra, and that's actually this device here. And so we can actually see the prostate in front of us. But we also have an ultrasound probe in the rectum, which is providing us with a 3D depth image of how deep the prostate is, which you cannot tell from seeing the surface of the prostate alone. And in combining both the camera and the ultrasound, we can create a map and avoid the sensitive areas that, if damaged, can lead to permanent complications, such as erectile dysfunction and ejaculatory dysfunction and incontinence. So for those that are interested in more of the anatomy of how this works, this is what we actually would end up seeing on the ultrasound screen. So we actually can plan out exactly the areas that we want to treat. For example, here, this is called the median lobe of the prostate. So we can actually tailor the water jet to treat this area, spare the bladder neck, which is right next to it, treat the lateral lobes, and spare the verumontanum and sphincter here. So we were actually shaping the water jet precisely to carve out exactly where we want it to be carved. Here is the view again from the camera of what we see. This is actually prostate tissue here. This is the urine channel, and it's a tiny, tiny slit. This is before treatment. This is how the prostate looks in ultrasound before treatment. And then after treatment, you can appreciate this. This is now wide open here, this area. And all this dark area is a wide open channel now, which did not exist before treatment. So why would we choose aquablation therapy over other procedures? Again, we touched on these points, but you have low rates of permanent complications due to the ultrasound and the water jet technology. This is a robotically controlled water jet, so it's very precise and predictable. And the relief is actually proven to be long-term and durable. So you'll probably be okay with just one of these procedures in your entire life. In terms of recovery, what can patients expect? Well, the operation is about an hour. You will wake up with a catheter, as you would with any other resective prostate procedure. And you will stay overnight in the hospital and have your bladder continuously washed overnight. And then you'll go home the next morning with the catheter, typically for about 5 days. And after 5 days, you come back to our clinic, we remove the catheter, and almost immediately patients experience a tremendous improvement in their urine flow. They may experience as well some burning with urination, which tends to subside after a few days to weeks. And we'll have you resume your normal activities within 1 or 2 weeks of surgery. So here's just a patient perspective on their journey with aquablation. I'll just go ahead and play that for you now.
When you first start having the problem, you got to go. The worst part is you stand there and you can't go. I'm 62, really active. I take really good care of myself. There was really no easy solutions. It happens to be a urinary tract problem that could ultimately lead to an erection problem or sexual dysfunction problem. Everybody says, welcome to the club. I don't want to be part of that club.
Ed's always been full of energy and larger than life. When I noticed that he was not the same, I knew that the BPH was causing him a big problem. He just wasn't as engaged.
BPH, benign prostatic hyperplasia, essentially is an enlargement of the prostate. In simple terms, when it starts to get enlarged like that, you can't go pee. When I laid down, it seemed to put more pressure on my bladder, hence I would get up almost every hour on the hour. You can imagine what it does to your sleep. I mean, literally towards the end, it became just like having a bad nightmare. And I find myself getting severe lack of sleep. Well, that affected my mood, my stress levels. It seemed to cause me constant worry because it was always on my mind.
When the person you love starts to change, it's an unsettling feeling. It started to affect things that we were doing. I mean, intimacy has been a really big part of our relationship, and that was definitely affected.
But ultimately, you kind of mask over what's going on, and I think we try to kid ourselves that I can deal with this. But once you get into a medium to severe BPH problem, you really don't have much choice. You're going to have some type of surgery. Meds don't work at that point. I did all the research possible. I mean, I went on every website quizzing the doctors, and I found out that there's probably 3 or 4 different procedures. They all have potential side effects. And in men's health, I don't think this is something anybody should fool around with. I really didn't want to compromise. When I came across the Aquablation, I realized that I didn't have to make those compromises. All I had to do was make the choice. For me, it was a no-brainer to go forward with the Aquablation.
The procedure overall was quick. He didn't have any complications.
I could not believe the result that I had. It was immediate. I forgot what my real freedom was like. I had no problems, no side effects from a sexual standpoint. And it's just amazing that I don't think about going to the bathroom anymore. It was like not only just treating me, but treating my life, my lifestyle. It gave it all back to me again.
Now he's back to his old self. It's actually changed our relationship for the better. It's just completely different. And we've completely reconnected. I'm really grateful for that. I have my best friend back. You don't have to grow distance in your relationship because of something like BPH. For anybody out there who's going through similar things, I would not hesitate to look into this procedure.
It's so different now. I mean, to say it's a 180 is an understatement, because once you've been on both sides of it, it's life-changing and life-altering. It's freedom. Boy, let me tell you, I made the right decision.
So that concludes my talk. I would like to invite anybody that has any questions or interests in aquablation or really any other men's health issue, prostate cancer, erectile dysfunction, kidney stones. We see everything. So please visit us at our department here at Garnet Health in Middletown. You can call us at 845-333-7575. And we also have an office in Harris, and that's 845-794-0996. And so with that, I'm happy to take any questions. If anybody has any.
All right, would anybody like to go ahead and unmute or possibly write into the chat? And I will say that we did our first case at Garnet Health for Aquablation. It looks like it was only at the end of March. So it was March 28th, and we have completed 14 procedures since. So this is definitely something that we're seeing an interest in. So does anyone have any questions?
Hi, this is Dr. King. I don't have any question, but Dr. Bobby, I want to thank you for the talk, and you're wondering why am I on the line. Well, sometimes some of my patients complain, have sexual dysfunction, not necessarily due to them, but to the spouse having BPH or what have you. And this is great to know that you and your partner, you guys are offering this procedure here at Garnet. So we'll definitely share the word and let them know and send them in for consultation. Thank you.
Thank you very much. Appreciate it. Yeah, I will say, Jessie, that and Jeff knows firsthand, but this procedure, and I didn't know this going in, but this procedure, I have experienced the most patient satisfaction out of any procedure that I do. And I do cancer surgeries, but almost invariably, every patient that I have seen after this procedure has told me this has been a life-changing procedure for them. And they are so grateful that we brought this technology in.
All right, well, I don't see any questions coming in, but thank you so much. This was a wonderful presentation. This is a fantastic new procedure that we're able to offer here at Garnet Health. And I believe we are the first within the area to provide this service. So please share the information with anyone that it might be relevant to. And again, like Dr. Philip King said, even if it is not directly impacting you or the patient you're seeing, it could be your patient's partner that is having these issues. So absolutely. And if anyone is looking for any additional information or assistance, you can always reach out to me. Again, my name is Jessie Moore, and I'm the physician liaison here at Garnet Health. So Dr. Borby, thank you so much. This is fantastic. Jeff, thank you so much for joining.
Thank you. Take care, everyone.
Have a great afternoon, everyone.
Thank you. Have a great afternoon. Bye.